give you some good information on what we're currently seeing. So just to give you a background, if you don't know who I am, I work for a revenue cycle management company that does only orthopedic surgery. We currently are servicing around 200 physicians and about 300 to 400 providers in general. We do the orthopedic surgery, podiatry, rheumatology, pain, anything that you probably or might have in your office, we are servicing it here. So we work with the insurance companies and coding and billing and denials for these procedures like you do every day. So let's take a look at the agenda for today on slide number 3. And you can see that we want to talk about the 3 major components, or the 3 most popular arthroscopy cases that you're probably dealing with today, and that is the hip, knee, and shoulder. We then have some new procedures that I would like to talk about, and I also want to take a look at some current commercial insurance policies that we continue to struggle with our clients related to arthroscopy and the payment or denial of arthroscopy procedures. So let's jump into the hip. So as far as hip arthroscopy, there are really basically 5 codes that we're dealing with. These 2 are ones that have been around for quite a bit of time. It's the 29862 and the 29863. I'm not going to read you the descriptions, but I like to have those descriptions on my slide so that if you want to reference this after today's conference, which I hope you do, you'll have that information in front of you. You don't necessarily have to pull out your CPT manual. So you can see that 29862 has to do with debridement and whatnot, and your 29863 is synovectomy. Now the other 3 codes that are a little bit newer when it comes to hip arthroscopy are the 29914, 29915, and 29916. And you can see 29914 is the example they give is a cam lesion. 29915, they give you an example of a pincher lesion. And then the labral repair is 29916. Now CPT has very specific guidelines as to how you should be using these codes and what code combinations can you use. And if you look in the CPT manual where these codes are listed, you will see that they say you can't report 29914 with 29915 or 29915 with 29916. They're very specific in the parentheticals how you can use these codes. I have one surgeon that does hip arthroscopy quite frequently, and we're constantly having this discussion that, you know, we can't, these code combinations are important, and it's not a Medicare thing, it's a CPT thing. And when it's a CPT thing, it doesn't matter what insurance it is, we have to follow the CPT guidelines. The only thing that would break that is if in fact an insurance had their own policy that would give us direction on this. Otherwise, we have to follow the CPT guidelines. So what I did on slide number 6 is I created a table for you, and I recently worked on this a little bit more with the code combinations as to what you can bill with what. So, for example, you can report 29914 with 29915 and 29916, but you can't report 29915 and 29916 together. And then you can also see that 29862 and 29863, can never be reported with these other codes. And again, we're following CPT guidelines here, and so this would apply to all insurance companies. The other thing I deal with, and I'm the same physician that I'm working with these hip procedures, is that there are a limited number of codes, and there are more and more arthroscopic hip procedures being performed, and unfortunately the coding is behind in the technology or the procedures. So there are several, and I have some of the more common ones listed here that are being currently performed that do not have a CPT code when they are performed arthroscopically. One of the things that I deal with all the time is the surgeon wants to then go to the open code and report that in lieu of billing an unlisted code. You should never be using an open code if something's being performed arthroscopically. If it doesn't have an arthroscopic code, then you're going to need to go to the unlisted arthroscopic code. You should not be using an open code instead. And so I see that all the time. Even when I do coding assessments, we do some consulting work for orthopedic practices, and I very often will see, instead of the 29999, they're using the open code that represents that procedure. And that, again, is incorrect because it is not being performed open, it's being performed arthroscopically. All right, so that's what I have on the hip. Let's go ahead now and take a look at the knee. And there are a lot more codes related to the knee. I got to tell you, some years ago, I had knee arthroscopy surgery, and I remember my physician telling me this is the newest thing. And so these codes go back almost 40 years, to be honest. And so, or I should say some of these codes go back almost 40 years. So slide number 8, I've kind of, in the knee section, for the sake of time and space, kind of given you the abbreviated description of these codes, and noticing that there is a difference between the codes related to autograft and allografts when you're doing osteochondral defects. Autograft meaning it's the patient's own graft, allograft meaning it's coming from someone else and usually taken out of a package of sorts. The 29870 is the diagnostic arthroscopy, and another CPT guideline is that the diagnostic arthroscopy is always included in other arthroscopic procedures performed on the same